Hello, my name is Esther Shadare. My mobile app concentrates on medication adherence with patients diagnosed with schizophrenia. For the past 4 years, I've had the opportunity to work with this population, and I've come to realize that the major problem that causes relapse and hospitalization amongst this population is due to noncompliance or non adherence to medication. Schizophrenia or Schizophrenia Spectrum Disorder is considered one of the leading causes of long-term or chronic disability. It has such a negative impact on one's personal, social, and economic aspect of one's life. It is an incapacitating mental illness with unexplainable phenomena. This picture on the right speaks so much volume. This is what a schizophrenic patient, goes through during an acute phase. I will speak more of this later on during the presentation. Schizophrenia is characterized by negative and positive symptoms. The negative symptoms of schizophrenia includes expressive deficits, which the American Psychological Association defines as the inability of a person to express self adequately, and avolition, which is the inability of a person to actually do what is considered normal. The positive symptoms of schizophrenia is considered the psychotic symptoms associated with it, which includes hallucination, delusions, disorganized speech, and behavior. The features of schizophrenia is stated in this diagram, and it just speaks very well about the cognitive deficit, disorganization, mood symptoms, the negative symptoms, and the positive symptoms, and how this can affect someone's functional ability. It affects school, work, interpersonal relationship, and self-care. Schizophrenia affects 0.7% of the United population, that is the adult population. The incidence rate of schizophrenia is 22 per 100,000 person years, and the prevalence of the disease is 3.5 per 1,000 person years. The peak age of diagnosis is identified to be between 15 to 25. That is to say that after the age of 25, the probability of being diagnosed with schizophrenia decreased by 40%. In treating a patient with schizophrenia, clinicians attempt to use both oral and long-acting injections. However, studies have shown that there is a high rate of noncompliance and non-adherence to oral antipsychotic. Therefore, it is leading to relapse and hospitalization of patients with schizophrenia. In order to best understand my mobile app, I feel it necessary to define medication adherence. It is an active, voluntary function that allows collaboration with mutual understanding between the clinician and the patient. The main problem is that non-adherence to medication is becoming a growing concern within the healthcare system. This is because non-adherence caused an increase in the prevalence of adverse outcomes among patients. More importantly, it is costing the healthcare system lots of money. What will this mobile app do for this patient? It will empower them, it would act as an electronic reminder, and it would help even the patients and the clinicians to track medication adherence. This mobile app will work effectively because it helps to focus on the challenges that are faced with patients with schizophrenia. It will help with the challenges of frequent relapse, persistence of psychotic symptoms, non-adherence or compliance to antipsychotic medication, recurrent hospitalization, and the increased burden on healthcare available resources. And don't let us forget, schizophrenia is very incapacitating. So this is also a burden, not only healthcare system, but as well as family. In order to do this, I had the opportunity to collaborate with people that I work with on a daily basis. And I chose these three people because we always thinking together, we're always collaborating, talking about different ways to find solution to patient relapse and hospitalization. I chose a psychiatrist, a clinical educator, and as well as another registered nurse. The mobile app that I have chosen is called My PillBox. This slide says a lot about My PillBox, but the following slides will help to explain better what My PillBox will do for the patients. My PillBox. In order to be able to utilize this app, the patient are required to have a smartphone or a tablet or a computer. Not just having a phone. It becomes useless when the patient has a device but do not know how to use it or the app itself. So that means the patient has to have good training and understanding on how to navigate through the app. The app is very user friendly. We already know that the patients that we are dealing with are very compromised. So we don't need to give them anything extra sophisticated. We need something very simple. And the best thing about this, it allows for multiple users. So a patient, a mother that has a son or daughter with schizophrenia can actually download this app and utilize it for themselves as well as their offspring. Once the medication are put in the system, you are allowed to pick the time when you would like to take the medication. And once the time has been chosen, the app serves as an alarm system. At the moment that this medication is due to be taken, an alarm will go off to remind you to take your medication. The best thing I love about this app is the ability for patients to actually document the medication effectiveness. Granted, it is not done immediately, but once the patient takes the medication, at the due time for the next dose, the patient can state whether they feel worse, the same, or better. And I think this helps the clinicians to track the effectiveness of the medication that they have prescribed for the patient. And another great thing about this app is it reminds you when the medication is due. So at the time that you are putting in the medication, you do put in the amount of medication you have in your bottle. And when you take the medication, it counts down, which will remind you when there is no more pill in the bottle and when it's time for refill. I think we are all slack behind when it comes to refill. If the pharmacy had not called, most of us don't even remember that we have medication to be refilled. As well, it syncs with patient's EMR and it helps with medication reconciliation, which is one thing that a lot of hospitals struggles with at this time. Why did I propose this? Or why do I think this would be a solution? I work with these patients every single day and I see their pain, their suffering. And I think this app would help to improve their health. It would empower them because they feel like they're in control of what is going on in their life. It helps with collaboration with physician and other healthcare providers, the social worker, the case manager. As stated before, it is an electronic reminder. And most importantly, it helps to track medication and also tracks adherence. Granted, physicians are not there to whether or not patients have taken the medication, but with a trusted relationship that has been built between the physician and the patient, we just have to agree that once the patient has hit taken, that means the medication has been taken and they're adhering and being compliant to treatment plan. Thank you very much for listening to my presentation and have a good day.